Menopause is a life stage, but it doesn't mean that you have to suffer. It's really important that if you are experiencing symptoms that you seek advice. The average age of the menopause is 52, but the average age of the perimenopause, which is the transition and a much less quantifiable period of time, it can last many, many years, is 46. So it's a lot younger than you might think. Symptoms in the perimenopause include heavy menstrual bleeding, which we covered last week, and also vasomotor symptoms. Those are hot flushes and night sweats. And the most important thing is that whoever sees you will undertake an individualized risk assessment. So they will take a medical history, including what medication you're on. It's important that your blood pressure is checked, and having high blood pressure doesn't mean that you can't have HRT, but it's important that your blood pressure is controlled, and that will then reduce your overall cardiovascular risk. And it's also important that we support you as healthcare professionals to manage your weight, to reduce your weight if you're overweight, to reduce your risk of diabetes and the cardiovascular risk that comes with that. And that's bearing in mind that actually the commonest cause of death post-menopause for women is heart attacks. And I think many patients think it's breast cancer. And unfortunately, breast cancer is a very common problem. It affects 1 in 7 women. But your chances of dying from breast cancer are no greater if you've had HRT. And in fact, there are other significant benefits associated with HRT, including a reduction in cardiovascular risk if you start treatment early enough, and maintenance of bone mineral density, and also maintenance of tissue quality. So I'm not suggesting for a minute that all women have HRT, but I think it's really important that you have an opportunity to have a discussion with somebody who can advise you. I've written this booklet about managing the menopause for patients, and we'll post the link for the booklet so that you can access that if you wish. There are areas where you can record your own symptoms to help you remember what you want to talk to either your doctor, your practice nurse, or your pharmacist about when you go and see them. If we think about HRT, it's not just tablets. This can be delivered through the skin as a patch, a gel, or now a spray. And if you have your womb intact, so it's still there, you haven't had a hysterectomy, you need something to protect the lining of the womb. That's a second hormone. But the most important hormone to make you feel better is estrogen, because that's what you're deficient in, and sometimes also testosterone. I think it's also important to say that many women suffer from the effects of lack of estrogen in the vagina and the bladder, and vaginal estrogen can be added into what we call systemic therapy. So that's either tablets or the patches, gels and sprays that I was talking about earlier. One of the commonest questions that women ask me is, how long can I stay on treatment? And will my symptoms come back when I stop treatment? So these are important points. You do not need a blood test to diagnose the menopause if you're over at the age of 45. This should be based on your symptoms. So you need somebody who's going to listen to you, and there is no mandatory stopping point. So for some women, it may be that they decide to stop treatment at 60. Other women will experience health events. They may develop breast cancer, and therefore they may have to discontinue treatment. And for other women who remain healthy and who've experienced a huge amount of benefit, they may continue longer term. But the recommendation is to use treatment through the skin as women get older, over the age of 60, and to use the lowest dose, which controls their symptoms. So I hope I've given you some things to consider. Obviously, we can't cover everything in this very brief podcast, but my main goal here is to ensure that women don't just get their heads down and try to get through the menopause without help, because there is lots of help out there. Thank you for listening, and we'll speak again next week.